Hi everyone. So today we have Teresa here with us from Vancouver Neurotherapy Health Services, and we are going to discuss ASD and mental health. Okay, so to start off, what are the main benefits of combining biofeedback neurotherapy and allied health services?
Sure, thank you for asking. Today we're going to have a great discussion. The main benefit of integrating biofeedback with allied health services is you get the benefit of both. You get both the improvements in any physio or occupational therapy or chiropractic, or if the person's using a psychologist, they can benefit from the behavioral modification that the psychologist offers, whereby the neurofeedback and the biofeedback activities will allow self-regulation and teaching the individual to monitor their own symptoms and calm their own nervous system without active involvement of a therapist.
Okay. So how many sessions are typically needed for noticeable improvement?
That's an excellent question. Normally, 1 to 10 sessions are most typical
Okay.
for the initial introduction.
Mm-hmm.
One, if the individual just wants a general idea of what's happening neurologically or physiologically, a diagnostic session essentially,
Mm-hmm.
where a brain map or a mini brain map is performed. And then longer if they want to be able to actually achieve outcomes. It takes between 10 sessions for chronic headaches, migraines, anxiety, or even depression, where other conditions like the ASD symptoms will take longer, or brain injury, intellectual disability, and cognitive challenges. Even things like schizophrenia, after 10 sessions, can improve the symptoms by teaching the individual to calm their nervous system.
Oh, that's quite impressive, 10
Mm-hmm.
sessions. So what muscles are typically monitored and why?
If the person's experiencing a headache, we're going to look at where is the headache. Is it a temporalis? If so, we'll place the electrodes and the EMG on the frontalis muscle.
Mm-hmm.
If they're grinding their teeth and experiencing TMJ, then we're going to place the electrode monitoring devices on the jaw. And if the person is experiencing tension from stress and their neck and their back is sore, we might place it on the neck or even the trapezius muscle at the back.
And during the biofeedback sessions, are there any exercises or activities done in particular?
Yes, very good question. So the types of exercises that are done are frequently deep breathing, where we teach the individual to breathe in for 5 seconds and out for 5 seconds. So we want to give the individual tools for transformation, where they can feel empowered that the locus of control is within them instead of the therapist or outside them with their clinician, and empowering them so they can move beyond the need to always have someone else to regulate them.
Mm-hmm.
And this helps lower healthcare costs and lower families' care costs and case management costs, because now the therapy can be done with a support aide or with someone who's knows the individual and can teach them relaxation exercises with the biofeedback as a tool.
Okay. And how do therapists measure progress over time?
Another excellent question. Progress is measured through the physiological monitoring devices. So session by session, you can see a trend where the EEG will either lower in its delta activity or start rising in the focused sensory motor and beta state, as well as lowering the higher gamma and beta activity that would contribute to things such as ruminating thoughts, obsessive thoughts, anxiety, and psychiatric disturbances, even things like schizophrenia. You'll have a very high delta activity or ADHD. The delta will be through the roof. As soon as you start lowering those delta levels and the theta levels, you can start to get a reduction in inattention, impulsivity, as well as improved cognitive capacity for decision making. Every aspect of the autism scale can be lowered using biofeedback, which is very promising.
Mhm.
If you combine that with other modes like occupational therapy, physiotherapy, speech therapy, you really have a surefire, all encompassing method to bring people to a complete recovery.
And that kind of leads into my next question. What brainwave patterns are targeted in ASD treatment?
Another brilliant question. So we will work at reducing, there's two theories of thought. One is to reduce the delta, reduce the theta for inattention and daydreaming, and increase the sensory motor rhythm and the beta. That's a traditional approach. And the other protocol that's often done if the person has comorbidities of anxiety or depression, we might actually teach them alpha theta training and do a few sessions of alpha theta training where they're calming their nervous system. And in calming it, they're bringing the alpha up and the theta up. And so the two are floating as they learn how to stay in a state of calm awareness without getting agitated or getting tense that frequently leads to other symptoms such as pain, insomnia, bruxism, or complex conditions.
So in a way, more somatic?
Yes,
Yes.
it's all about psychosomatic.
Yes.
Biofeedback is all about learning how to shift
Yes.
the psychosomatic symptoms so that people can be aware of what's happening, including their heart rate, respiration, temperature on the back of the hand, sweat on the hand through two fingers that are non-adjacent, electromyography for muscle tension and grinding, as well as the actual mental health conditions that are brain-based.
Okay. Is neurofeedback effective for co-occurring conditions like ADHD or anxiety?
Yes, it is. Similar protocol as
Thank you,
Harveen. So today we're going to continue with our conversation yesterday, and you had some more questions for me.
Yes, I did. So our first question is, what percentage of individuals with ASD, according to the DSM, are likely to have one or more comorbid mental disorders?
According to the research, they're saying about 40%
Wow.
end up having comorbidities of more than one condition. But 70% of individuals have a comorbidity of mental health and autism.
Wow.
So that's quite a lot.
Yes.
And so that for parents, that's a real challenge because not only do they have the challenges of living and navigating life with ASD and the symptoms that it brings, but they have so much more that they have to cope with, such as depression, anxiety, stress, and even complex conditions like psychosis and psychiatric disorders of schizophrenia. So today we're going to discuss some of the pathogenical and neurophysiological features that are seen. And what we notice is that when you reduce the delta and theta activity during the sessions, these individuals would be coined as like EEG regulators in research. And we're able to increase their cognitive flexibility after 10 to 12 sessions, where those that were given skin conductance recording the sweat on their skin, they learned how to improve their emotional regulation, but didn't have the cognitive flexibility that the EEG biofeedback allowed for. 45% that are trained can reduce their delta theta activity and be successful. Even 6 months after follow-up, the parent ratings and executive functions and 19-channel EEG recordings comparison, they were success. The other consideration is using heart rate variability to help address anxiety with ASD. So when people use a heart rate variability, you can achieve a meaningful outcome. The challenge is, if you do 10 sessions, these individuals often are not responsive to CBT because CBT involves a lot of cognitive component and rationalizing, thinking about things. They may not have the capacity, but with heart rate variability, they can reduce their anxiety and the state symptoms of anxiety by learning how to regulate their heart rate. And this persisted 6 months later so that they could then have a reduced anxiety state. Interestingly enough, these participants were not aware that their anxiety had gone down. They were college students experiencing ASD and anxiety. So they perceived their anxiety as getting worse and going up. But the fact that they're going through exams, testing, and all the things associated with college could have contributed to that, despite their improvements in symptoms.
So, what are some characteristics of anxiety in individuals with ASD?
You'll see sweating of the hands, and that's where the skin conductance comes handy, and they can learn how to control it through the skin conductance variability. Then that gives them more tools so that when they're stressed in an exam and they feel like screaming, they can remember the deep breathing and regulating their sweat on their skin, or calming their heart rate and reducing the racing heartbeat that they're experiencing, or the dry mouth that is occurring in their mouth. They may have a beverage that they could use and incorporate some dialectic behavioral therapy with it to help calm themselves, smelling the beverage, sipping it, being aware of the temperature of the beverage, how it feels in their mouth. And these little steps that we can take can all help reduce symptoms and overall improve the concurrence of mental health conditions that occur.
And can biofeedback therapy improve emotional regulation in individuals with ASD?
Yes, because they're learning how to regulate their nervous system on an unconscious level. So when the brain is in the delta state, it will be reactive. It will end up exploding. And the person might not know why they had an outbreak or why they melted down or why they just couldn't get through the door to the next class and felt defeated. Suddenly, the nervous system they can gain control over managing, and these symptoms can dissipate.
And are there certain techniques, biofeedback techniques, that work best for autistic individuals with anxiety or depression?
Yes, there would be. And modeling that behavior and teaching them how to be calm and what that looks like so that you're not describing it because they may not be verbal.
Yeah.
You could describe it, but you may be more effective just saying, copy me. Let's see if you could sit and think of something relaxing. And when they see you relaxing, holding your cup of tea and enjoying a painting and just looking at the painting and being descriptive of that, that can give them tools of what they need to do when they're stressed and experiencing symptoms.
So kind of like modeled behavior.
It's all about modeling.
Yes.
And through modeling, they learn from their therapist.
Yeah.
And then can take that away with them instead of an academic, do this, do this, do this.
So it's kind of like adding to their toolkit.
Yeah, their toolkit expands and they can be more effective.
Yes.
One of the challenges that our current healthcare system faces is that we're not fully prepared to manage crises for people that experience autism because of the shortage of mental health providers and programs that are tailored to this client group. New strategies to address the crisis are emerging and evolving, but it's really having a crisis management approach for the family. And what are we going to do when these symptoms arise so that they're not waiting on an appointment that they may not get for months. Their next psychiatry visit may not be months to now, and they can't wait that long. They need to have the locus of control within them that they can feel empowered. And biofeedback allows that to happen because we're tooling the person with new strategies.
Perfect.
The DSM states that Persistent deficits in social emotional communication and interaction, along with restrictive repetitive patterns of behavior, activities, or interests, are present in early development, causing significant impairment. Difficulties with social approach, sharing interests, and expressing and understanding emotions are the key definition for DSM classification of autism. The challenge is many people don't fit nicely that box, and as a result, they may have some symptoms but not qualify for funding. And as a result, go through a cyclical loop where they just can't get anywhere because they can't access the program, they don't have the diagnosis, and their anxiety level then shoots up. And the anxiety is a predictor of reduced graduation rates. However, we know now there's tools such as heart rate variability to be an effective intervention.
Yes.
And that study was done at Baylor University, the School of Education. So anyone interested in looking that up, Coleman, Treitz, Parker, and Nicholas in 2024 published that. And another study published in 2013 was, is EEG biofeedback an effective treatment for ASD? This was a randomized control study, and it was able to demonstrate the earlier findings that I was discussing with you. Other studies that may be of interest include research on the pathogenical and neurophysiological functions of patients with ASD, phenomena, and diagnosis, and how they used EEG as a tool to quantitatively explore the neurological changes in these individuals, and how inflammation in the brain and melatonin is a critical neurohormone that is believed to play a role in their neuropsychiatric symptoms. And that research was done by Jin, Choi, Lee, and Kin, as well as Hong in 2019. So there's plenty of research that's out there. And now it's about picking up the torch and sharing it with people and explaining how primary deficits in their ability to interpret social communication or initiate and maintain social interactions, handle anxiety, shift mental states, and sustain attention and response control can be improved. And the EEG at the PZ, the P4, parietal 4, the temporalis 6, and the frontal region 4, as well as the prefrontal cortex 1, have differences in communication coherence and co-modulation. That is what we find in the ASD population. So symptoms can be improved once we get these regions regulated and talking to each other. It's like a telephone line.
Yeah.
Once we get the clear communication happening, then these symptoms start dropping off.
Yeah.
And we start seeing improved coherence. And Mark Schwartz and Frank Andrasik in 2003 published some great research that discusses all of the different mental health conditions and using medical tools and diagnostics to help reduce these symptoms.
Wow. Okay.
They went into detail about biofeedback, behavioral relaxation training, and modeling, prompting, providing feedback and positive reinforcement using 10 sessions. And that therapists could actually demonstrate to their client how to relax their hands and continue with different postures to successfully reduce symptoms in the moment. And since this doesn't require a therapist, it can be learned by care aides and family members to help transfer that knowledge and decrease their medication by 50%, as well as their complaints of headaches.
So kind of if it's incorporated all around in everyday life,
That's right.
The individual is more opposed, I guess, to pick up on it.
Well, they're able to reduce their tension and improve relaxation. And once they maintain it for 60 seconds, they'll get a positive reinforcement. Then We then extend that, such as using a beverage or other things to reinforce the client's behavior. For more information, feel free to call us.
Yes, thank you everyone for joining us. Thank you, Teresa, for joining us.
It was a pleasure. Look forward to sharing more knowledge with you.